My name is Paulo Ramos. I am a Brazilian dermatologist and I work especially with hair disorders. I'm also a researcher and I have been studying oral minoxidil as an option for hair loss. Probably you have heard about topical minoxidil as a treatment for hair loss, and it really works. But some patients can't use topical minoxidil because of itching or scaling, or sometimes altered hair texture or difficulty for hairstyling. All of these small problems could be a real problem for some patients. So we have oral minoxidil as an option. Oral minoxidil, in fact, is labeled for hypertension, so it's an antihypertensive drug. And for hypertension, the usual dose ranges from 10 to 40 milligrams per day, and it's off-label for hair loss, but we can use it in lower doses. So in very low doses, like 0.25 milligrams per day, up to 5 milligrams per day. So nowadays we don't have the optimal dose or the perfect dose, but we know that with lower doses we can still have hair growth. So I would say that oral minoxidil is a great option for patients for androgenetic alopecia, especially those ones that can't really use a topical minoxidil in their daily life because it's too busy, it takes time to apply, and it's so easier to take a pill for many patients. On top of that, you can combine oral minoxidil with other treatments like finasteride, like dutasteride, or procedures, or even hair transplant. So it's very common for us to combine with other treatments, okay? When it comes to adverse effects, the most common adverse effect is generalized hypertrichosis. So you may see hairs growing on the face, on other parts of the body, but it's generally mild, it's generally well tolerated, and of course, depend on the patient, but it's commonly not a huge problem. Some patients may present headaches or insomnia, edema, so a swelling more commonly in the legs. And this type of adverse effects are not so common, but they may happen, and they are related to the dose. So it's important for you to go to your doctor and see if you have any problems with your health, if you're okay to go with oral minoxidil. At the beginning, you can start with lower doses and gradually increase the dose, and that's a strategy to avoid adverse effects. We don't know what's the optimal dose. For men and women, we are now proceeding with a lot of studies, but probably around 1 milligram could be enough for most women. And for men, we can go with higher doses, around 2.5, and some men we can go up to 5 milligrams per day. But of course, it's important for you to be evaluated by your doctor, and maybe start with a lower dose and increase with time. So commonly, we combine oral minoxidil with other drugs. In men, we commonly combine with finasteride. It's not mandatory, you can use only oral minoxidil, but if you can combine treatment, probably you will be able to get better results. We know that finasteride and minoxidil act on the hair follicle in different ways. So probably if you add treatments, you can get better results. But at the end of the day, some patients just use finasteride, some patients just use minoxidil, some patients may respond better to one treatment, some patients may respond better to the other one, and some patients need an extra potency on the treatment, and we can use both together. So it depends on your case and the evaluation of your doctor. So it's important to say that even for those patients that are looking for surgery, most of them will still need medical treatment with drugs, finasteride or oral minoxidil, because we know that androgenetic alopecia is a progressive condition. There is a chance that over time you may lose hair in other areas that were not treated with the surgery. Your possibility to do new surgeries will depend on the quality of your donor area. So in most cases, medical treatment is really important, even for those patients that will go to surgery. There is no one size fits all, so you must be evaluated by your doctor and program your treatment, your medical treatment, the moment for your surgery, the follow-up. So this way you can get good results at the short term, but also in the long term.